Hi everybody. So we're back at it, talking about the hemoglobin A1C. So the A1C is the averaging of the sugars, and the reason I feel it's one of the most, if not the most important blood test is because it's predictive value for the potential for future diseases that are mentioned here on the chart. We talked a lot about what can cause it, obviously being a diabetic, an A1C above 6.5, pre-diabetic, an A1C between 5.7 and 6.5, and oftentimes when I'm speaking to you, my patients, about how to improve the A1C, it's pretty regimented, and we'll go through the process right now. So basically, insulin is responsible for most blood sugar problems because insulin over time becomes less effective. So your body needs more insulin, insulin produces more body fat, and you get into a vicious cycle of what's called insulin resistance. And then the A1C will typically go up. So conversely, if your A1C is already a bit elevated, how do you cut that cycle, so to speak? Well, the most obvious thing you would think would be carbohydrate restriction, low carb, low sugar diet. And the answer is yes. Ironically, if you go to the American Diabetic Association's website, the diet they recommend is not really a low carbohydrate, low sugar diet, certainly not to my estimation. Now, there's a term called practical ketogenic diet. I would recommend that. Now's not the time to get into the specifics, but basically, the first thing is you have to identify where carbohydrates and sugars are coming from. Things like fruit, juices, things that maybe are healthy or you thought were healthy. Certainly, there's added carbohydrates. I believe in about 80% of all the products at Publix added fructose in about 65% of those products as well. Hidden everywhere, ketchup, in salad dressings, in things that you would say peanut butter. Why is there fructose and sugar? Well, part of it is it's an addiction. So I'm sorry to tell you this, but companies like you addicted to their foods, and people like things that hit that pleasure center, which is sugar and carbohydrates. So the second thing is understanding that time-restricted eating is the probably easiest way to break that cycle of insulin resistance, where you're waking up eating, and then all of a sudden your insulin levels go up and you have to eat again and you have to eat again just to keep up with what's going on hormonally in your body. So what I tell my patients, you probably have been told this by me, is waking up and not eating is essential. You can have a coffee with cinnamon, black coffee preferably, and then an exercise is probably the best thing that can be done. Yes, on an empty stomach. If you need to drink a glass of water with lemon, 2 glasses of water, it's fine. You will survive walking or exercising. Now, if you're starting and you need to eat something right when you've done the exercise, that's fine. But slowly, as you push back your breakfast, maybe to not have breakfast eventually, that gives your body time to metabolize all that excess fat, carbohydrates, the things that are driving the insulin and then driving the A1C. So low carbohydrates, some time restricted eating, and exercise. So the key is those 3 things. It sounds simplistic, but getting them as habits is really the key to having your body respond. And then you can even kick in something called autophagy, where if you do that type of fasted exercise with time restriction, low carb, you'll actually start to metabolize more calories even when you're not exercising. Autophagy actually means self-eating in Latin. And then the 4th thing that I recommend to everybody is try to go to sleep early. It's almost impossible not to eat if you're staying up in the evening after dinner watching television. If there's food in your house, you're going to eat it. And if there's snack food in your house, you're going to eat that. And that will ruin a whole day's of a good diet, of low carb, potentially even ketogenic dieting, of that exercise. Because if you're going to bed with food in your body, that means that your body has no time to metabolize what's already been there. So when you institute these changes, just these lifestyle changes, and you do it for weeks, a couple months, 2 months, 3 months, your body will become fully adapted. So 1, it will be less difficult. You'll start to push your breakfast up even further. But more importantly, in a 3-month period of time, you can have significant changes in the 3-month average hemoglobin A1C. And again, remember, why is it the most important number on the piece of paper? Because it's a marker of disease potential. So we know that an elevated A1C is going to be long-term not good for you. Short-term, it means that you have a metabolic problem. These can be acted on. Now, I didn't even get into supplements like berberine, cinnamon, fenugreek, basil, a lot of things you can cook with. There are a lot of supplements that I actually take that can help metabolize sugar and bring down the A1C. There's actually a prescription medication called metformin, which has other uses, including anti-aging. That's almost like an herb, even though it's by prescription. again, combined with berberine, has been shown to bring down the A1C significantly. So there's a lot of avenues to go. The key is to address where you are and start to figure out why did you get there, and then start to push it back. So I hope this was informative. Looking forward to interacting in the office, and looking forward to seeing you at the next video. Have a great day.